to another episode of That Nurse Tutorial Series. Today we will discuss about anatomical terminologies. The terminologies used in anatomy and medicine. Why is it important to learn these terms? Because in medical practice, we use these terms to explain concepts, to explain patients' conditions. Not only that, it establishes the professional way of communication between the healthcare professionals. These terminologies can be explained in terms of size, distance or direction, surface, planes, and body positions. Let's talk about the terminologies that relate to sides. Under sides, we have the medial, lateral, unilateral, bilateral, ipsilateral, and contralateral. But before we move on to explain these concepts, let's talk about the midline. Show me where midline is in your body. Midline is an imaginary line that you can imagine starting from the middle of your forehead, going down, passing through the middle of your nose, middle of your mouth, down to the neck, middle of your neck, and middle of your chest, down to the umbilicus, and down to the pubic organs. So this is your midline. So if we want to illustrate that on the screen, our midline is from the forehead, passing through the nose, the middle of the mouth, the middle of the neck, the middle of the chest, down to the abdomen, touching the umbilicus, and to the pubic organs. So this is the midline. You can also call it middle line, but in anatomy, we prefer to use the term midline. The midline divides the body into two sides, the right side and the left side. So we use these terminologies according to their relationship to the midline. Now, what is a medial side? A medial side is a side that faces the midline, that is close to the midline. Look at this limb, for instance. You can see this side here. This is the medial side because it is close to the midline. It faces the midline. So this is the medial side. Here too is medial because it is close to the midline. It faces the midline. If you want to talk about the lateral sides, you can see this is a lateral side. Because lateral side does not face the midline. It is away from the midline. It is away from the midline. It does not face the midline. So it is lateral. Who can tell me the medial size and lateral size of these legs? Who can show me the medial side and lateral side of these legs? What do we call these sides? Is this medial or lateral? Look at the midline. Does this line or does this side face the midline? We can see that this side does not face the midline, so it is opposite the midline. So this is lateral. But this side is closer to the midline and it faces the midline. So this is medial. Medial from the word medium, that is something that is close to the middle. And this is the middle portion of the body. The medulla, the midline, the midline. So medial means close to the midline. I'm sorry, medial means a side that is close or facing the midline. So we've talked about the medial side and lateral side. What about the unilateral side? Unilateral side talks about a one-sided, or it means one side. Don't forget that unilateral, bilateral, ipsilateral, and contralateral are used to describe a structure or a organ that is paired. For instance, who can tell me paired organs? Who can name the paired organs? Any organ that has a second part that is twinned, that has twin, or that is a twin, is a paired organ. For instance, the two eyes, the right and left eyes, the right and left ears, the right nostril and left nostril, and we have the breast, the right and left breast. Anything that you can say right and left is a paired organ. The right upper limb and the left upper limb, the right lower leg and the right leg and the left leg, the right kidney and the left kidney, the right ovary and the left ovary, the right fallopian tube and the left fallopian tube, the right testis and the left testis. All these organs, all these structures are paired. If I say unilateral, unilateral means uni means one, lateral means side. So unilateral means one side. For instance, if I say the man has a unilateral blindness in his right eye, that is, only the right eye is blind. Bilateral means both sides. Lateral means side, bi means both. So bilateral means both sides. So if I say that this man is bilaterally blind, that means the man is blind in both eyes. If I say that the man is bilaterally deaf, that means both the right and left ears are deaf. If I say that the man is having nipple discharge from bilateral breast, that is, both the breasts are discharging. So bilateral means both sides. Now let's talk about ipsilateral. The word ipsi means same, and lateral means side. So this means same side. Ipsilateral means same side. For instance, if I say that this man is blind in the right eye, he also has discharge from the ipsilateral eye. That is, I'm still talking about the right eye. I'm still talking about the same eye. If I say that this man is deaf in the right ear, He also has wound in the ipsilateral ear. That is, this man is blind, is deaf in the right ear, and this same ear is also having wound. Ipsilateral means same side. What about the contralateral side? Contra, from the word contra, contrary, contradiction. So contra means opposite. So contralateral side means opposite side. Contralateral means opposite side. So in that case, if I say that this man is having deafness in the right ear, but the contralateral ear is in a normal functioning state. That is, the right ear is deaf, but the opposite ear is in a good state. If I say that this man has a right breast enlargement, that is, he has enlargement of the right breast, but the contralateral breast is in a good state. That is, the opposite breast is in a good shape, is normal. So these are the terms that we can use to explain sides in the body. The medial side that is close to the midline, the lateral side that is away from the midline, the unilateral, which means one side. Uni means one, lateral means side. Bilateral, bi means two, lateral means side, that is two sides. Ipsilateral, ipsi means same, lateral means side, that is same side. Contralateral, contra means opposite, lateral means side, that is the opposite side. Let's now discuss about the terms that relate to distance or direction. Under this, we have the proximal, distal, cephalic, and caudal. When we use the terms proximal and distal, we are referring to the extremities. Proximal and distal are terms used for extremities and how they are close to the point of attachment. Who can show me where the upper extremities and lower extremities are close to the point of attachment? Who can show me the points of attachment in this structure? The points of attachments are here, where the head of the humerus attaches to the scapula at the glenoid cavity. You can see it here too. The head of the humerus attaches to the scapula at the glenoid cavity. That is, these two upper arms are attached to the trunk. So this is the point of attachment. In the lower extremities, the head of the femur attaches to the pelvis. This is the pelvis at the acetabulum. That is, the head of the femur fuses into the acetabulum. So this is where we have the point of attachment. So anything that is close to this point of attachment is proximal. Anything that is far from this point of attachment is distal. So now, look at the head of the humerus, for instance. The head of the humerus is proximal to the elbow because head of the humerus is close to the point of attachment, while the elbow is far from the point of attachment. So we can say that the head of the humerus is proximal to the elbow because the head of the humerus is close to the point of attachment. But the elbow is distal to the head of the humerus because the elbow is far from the point of attachment. Now, what is the relationship between the elbow and the hand? Which one is proximal? Which one is distal? You can say that the elbow is closer to the point of attachment than the hand. So, elbow is proximal to the hand, while the hand is distal to the elbow because the hand is far from the point of attachment. Between the elbow and the hand, elbow is closer to the point of attachment than the hand. That is why the hand is distal to the elbow. Elbow is proximal to the hand. Elbow is distal to the head of the humerus, while humerus is proximal to the elbow. Another example is the head of the femur and the knee joint. The head of the femur is proximal to the knee because the head of the femur is close to the point of attachment. So the knee joint is distal to the head of the femur because the knee is far away from the point of attachment. So the knee and the foot, how can we describe the relationship? The knee is proximal to the foot, while the foot is distal to the knee. Now, let's talk about the cephalic. Cephalic from the word cephal. Cephalic means anything that relates to the head. Anything that is close to the head or to the brain. So, if I say that the clavicles here is cephalic, that is, these clavicles are close to the head. If I say, so in relation to the umbilicus, the navel here, if I say that the clavicles are cephalic to the umbilicus, I'm saying that the clavicles are closer to the head than the umbilicus. If I say that the breasts are cephalic to the pubis. I'm saying that the breasts are closer to the head than the pubis. So cephalic means towards the head. So now, what about the caudal? Caudal means tail, anything that relates to tail. Anything that relates to the tail. So for instance, if I say that the umbilicus is caudal to the clavicle, I'm saying that the umbilicus is closer to the tail of the body than the clavicle, than the clavicles. I can also say that the penis is caudal to umbilicus. That is, the penis is closer to the tail part of the body than the umbilicus. So that is how we explain the relationships of the structures or parts of the body. Now let's talk about superior and inferior. Superior means above, inferior means below. We use these terms constantly in our daily relationships, in our daily activities. Everyone knows what superior means. Everyone knows what inferior means. So we often use these terms to define our positions in a company, in an organization. For instance, if I say the head is superior to the neck, that is, the head is above the neck. If I say the neck is above the breasts, that is, if I say if I say the neck is superior to the breast, I'm saying that the neck is above the breasts. If I say that the breast is superior to the umbilicus, what I'm saying is that the breasts are above the umbilicus. So superior means anything that is above. Now inferior means below. Inferior means below. So if I say that the umbilicus is inferior to the breasts, that is, the umbilicus is below the breasts. So if I say that the mouth is inferior to the nose, that is, the mouth is below the nose. If I say that the nose is inferior to the eyes, what I'm saying is that the nose is below the eyes. Now let's use these two terms together. The two eyes are superior to the nose, while the nose lies inferior to the eyes. The nose lies superior to the mouth. The mouth lies inferior to the nose. So this is how we explain the positions of organs that are above and below, and not in relation to other parts of the body. So let's now talk about the terminologies that relate to the surface. You can see that this is the surface. This is my surface, the surface of my skin. So under these terminologies, we have the anterior. Anterior means front. From the word ant, Ant means something that comes first, front, something that shows first. So anterior means front. So this is the front view. This is the front view of the body. The front surface, the anterior surface of the body. For instance, this is my anterior surface. This is my front view. So this is the anterior surface. We can also use anterior terminology to explain the relationship of organ to one another. So anything that lies in front of another organ is anterior. So another term for anterior is ventral. So you can use the word ventral surface or anterior surface. They mean the same thing. So this is the ventral surface. This is my ventral surface. That is my anterior surface, my front view, my front side, my front surface. So that is anterior. So posterior means back. So this is the back view of the body. You can see. So this is the posterior. This is my posterior, the back view of my body. So this is the posterior. Like we have for anterior, some organs lies at the back of another organ. So they are posterior. So another term for posterior is dorsal. Dorsal means posterior. It means back. It means behind. So the dorsal surface is the same thing as the posterior surface. The dorsal view is the same thing as posterior view. That is the back view. We also have the palmar surface. The palmar surface. The palmar is derived from the word palm. So this is the palmar surface. So this is the palmar surface. This is the palmar surface. So we also have the plantar surface. Plantar surface is referring to the foot, the sole of the foot. Sole of the foot. Sole of the foot. You know, like we have the palm, we have the sole. That sole, so that surface of the sole is called plantar surface. It's called plantar surface. That is the sole of the foot. And we also have the deep surface. You know, that is an English word. That will take us to explain what superficial means. Superficial means close to the surface, while deep means away from the surface. So if I say that ribs are superficial while lungs are deep, what I'm saying is that the ribs are close to the surface, which is superficial, while the lungs lie deep within the thoracic cavity. That is, the lungs are far away from the surface. Look at the stomach and the abdominal muscles. The stomach lies deep in the abdomen, while the muscles of the abdomen lie superficial. It's those terms that relate to the body position. You will see more of these positions when you go for your clinical rotations. So we have the prone position. Prone position is a position where the front side of the body faces down. The anterior surface of the body faces down and the posterior surface of the body faces up. That is a prone position. So supine position is the opposite of prone. Supine position is a position where the face and abdomen faces upward and the posterior surface, the back view, faces downward. It's a position where the patient lies on their back. And prone position is a position where the patient lies on their front. So it's just the opposite. Now let's talk about the Fowler's position. Fowler position is where the head of the bed is elevated. Is elevated to some degrees. In that case, we have high Fowler position, semi-Fowler position, and low Fowler position based on the degrees. So, Fowler position is where the head of the bed is elevated to some degrees, thereby elevating the upper part of the patient's body. You can use this position in patients with respiratory disorders or with respiratory problems to allow for expansion of the lungs, to allow for ease of breathing. So we also have right lateral recumbent position. In this case, the patient lies on his right side. And we also have left lateral recumbent position. In this position, the patient lies on his left side. You can see lateral means side. So in right lateral, the patient lies on his right side. In left lateral position, the patient lies on his or her left side. Trilembar position is a position where a patient is supine but with the feet elevated higher than the head. You can use this position, to promote blood flow to the head. Let's now discuss about the planes of the body. There are three main planes that divide the body in different sections. We have the sagittal plane, we have the sagittal plane, the transverse plane, and the coronal plane. The sagittal plane is this. You can see this is the sagittal plane. You can see the sagittal plane divides the body into right and left. Let me make another illustration here. This is a sagittal plane. You can also call it midline. So the sagittal plane divides the body into right and left sides. We can also call it a midline that divides the body into the right and left side. So this is the sagittal plane. The transverse plane, which is this is the transverse plane. You can see the transverse plane divides the body into upper parts and lower parts. It divides the body into upper portion and lower portion. So you can say that this is a transverse plane. Another name for this transverse plane is horizontal plane or axial plane. Horizontal plane or axial plane dividing the body into the upper and the lower parts. Into the upper and the lower parts. We also have the coronal plane. You can see this is a coronal plane. Coronal plane. Coronal plane, divides the body into front and back. Into front and back. So I will show you clearly what these planes are. So you can see this is a sagittal plane, divides the body into right side and left side. You can see the midline. You can see the midline here. You can see the midline. So it is a form of midline that divides the body into right side and left side. We also have the transverse plane. This is a transverse plane, also known as horizontal plane or axial plane. It's also known as horizontal or axial. So this transverse plane divides the body into superior parts and inferior parts, into the upper part and the lower part. That is the transverse plane or horizontal or axial plane. We also have coronal plane. Coronal plane divides the body into anterior and posterior sides. Into anterior and posterior sides. That is, it divides the body into front parts and back parts, into front side and back side. So this is the coronal plane, dividing the body into anterior part or side and the posterior part or side. So these are the planes that we have in the body. Other terminologies that we use in medicine include some words that start with A or N, like A or N. Both means absence or lack. So if A or AN begins a medical word, it denotes an absence or lack of something. For example, if I say anemia, if I say anencephaly, I say anoxia, these terms are saying that there is a lack or absence of something. For instance, anemia means lack of blood. If we want to go by this definition, it means lack of blood. But we don't see lack of blood, but because there's no anemic patient that lack blood, it only means that the blood, the hemoglobin, is not in enough quantity. So anencephaly means absence of, from the word cephaly, we said that the other time. Cephal means anything that relates to the head or brain. So anencephaly means absence of brain, absence of brain or absence of head parts. So we also have anoxia. Anoxia means lack or absence. Oxia, from the word ox means oxygen. Anoxia means absence of oxygen, lack of oxygen. So when A or AN starts a medical word, it signals or it indicates lack or absence of something. We also have something like this. DYS is talking about difficulty. Anywhere you see DYS, it means that there is difficulty in something. For instance, if I say dysphagia, this means difficulty. Phag means to eat. Phag means to eat, to swallow. So dysphagia means difficulty in swallowing. So if I say dysuria, this means difficulty. Urea means urine. That is difficulty in passing urine. So the word DYS means difficulty. If I say dyspepsia, or dyspepsia. Dyspepsia means difficulty in digesting food. Another common term is dysmenorrhea. Which means difficult menstruation. But we don't say difficult menstruation, painful menstruation. So DYS can relate to difficulties or pain. So it can relate to difficulties or pain. Dysphagia, dysuria, dyspepsia, dysmenorrhea. So it can relate to difficulties or pain. We also have hyper and hypo. We know what that means. So hyper means something that is too high. Hypo means something that is too low. So if I say hypertension means high blood pressure. Hypotension means low blood pressure. If I say hyperkalemia means too high potassium, excessive amount of potassium. So hypokalemia means low amount of potassium, when potassium is too low. So we use the word hyper and hypo to explain the amount of a substance in the body. Holig means reduction in something. Reduction in something. So if I say oliguria means reduction in the amount of urine. That is the common meaning. But if you want to go deeper, it means that when the patient produces urine that is not above 400 mils in a day or in 24 hours, that's oliguria. But for this discussion, oliguria means a reduced amount of urine. That is oliguria, because olig means to reduce, reduction. So the opposite of that is poly. Poly means in large amounts, in excessive amounts. So polyuria will mean excessive amount of urine, polyuria. So there are many of these terms. So as we progress in anatomy and physiology, in pathophysiology, we begin to learn these terms in detail. So this is the end of today's tutorial. See you next time.